CVD is cardiovascular disease. I felt like this was applicable for this setting in physical therapy because we deal with a lot of older patients in here that would be applicable for that population. For individuals who are about 30 to 40 years old and below, they're at a low risk, but it's still possible for them, so you always need to keep an eye out for that. But mostly above that 40-year-old mark is where you need to start worrying about. The CDC and ACSM came up with minimum guidelines for exercise to achieve these health benefits that we're looking for in populations. This is more preventative measures for cardiovascular disease, and that generally occurs around about 30 minutes, 5 days a week of moderate exercise, or 20 minutes, 3 days a week of vigorous exercise. So obviously that's for a more trained population, younger population, to prevent cardiovascular disease. These guidelines are interchangeable. You don't have to do 30 minutes of moderate exercise 5 days a week. You can do 30 minutes one day, then you can do 20 minutes of vigorous exercise one day, and that'll do the trick for that. So the CVD and CDC also, they came up with levels for exercise to specify where people should be working at. You got the light exercise, moderate, and vigorous. These guidelines that I gave you before about the time per day, a common mistake is people think that's what they need to do to get things going. That is the bare minimum of exercise needed per week for the health benefits, and that's not even for weight loss or anything like that. All right, so according to the ACSM and CDC, individuals are at high risk classification for exercise at moderate and vigorous intensities if they have cardiovascular disease. Intensity can be measured in METs, or metabolic equivalents, and that's just kind of a chart that makes it easy for everyone to kind of get it. Low risk exercise is below 3 METs, 3 to 6 METs is moderate, and vigorous is more than 6. Endurance exercise has been shown to have the greatest direct benefits for those with cardiovascular disease. However, resistance training programs show similar benefits, but they go through different metabolic pathways, and it takes longer for those to show. So light resistance or light endurance training within the patient's limits is what is good for those with cardiovascular disease. Individuals with cardiovascular disease should stay at the minimum of exercise recommended by ACSM and the CDC. And again, those are for the minimal health benefits. They should include adequate recovery time in between each bout of exercise, meaning they should be fully recovered before they start exercising again. And that prevents any cardiac events from happening. They also need a qualified individual to be monitoring them while they're exercising, which pretty much everybody in the clinic is qualified. That means they need a CPR and AED in case a cardiac event occurs. If they are diagnosed with cardiovascular disease, they need to be seen by a physician before they can participate in anything. Untrained sedentary individuals prior to being diagnosed need to exercise in intensities below 3 METs, because if they go over that, even in non-cardiovascular disease populations, elderly individuals who do that are at risk for myocardial infarction or a heart attack. Cardiovascular disease patients must be made aware to pay attention to their body during exercise, because a lot of the signs that occur when someone's about to have a cardiac event are not visible to an individual watching. So they need to be alert of if they're getting short of breath when they're not doing stuff like that. They need to know that stuff before they begin exercise, so they don't not know when they're starting to feel that way. So we can go ahead and flip our sheets over. So again, they need to pay attention to themselves, and they need to be made aware of how to do that. Cardiovascular patients who have not previously participated in exercise need to stick to walking, pretty much start out. They need to stay below that 3 METs, and a walk down the neighborhood or something like that a couple times a week would be good for that. Those that have previously exercised can do activities such as golf that only requires about 4 METs, or slow dancing, which is a little bit more than 3, or any kind of yard work, which is less than 5. Some benefits for exercising cardiovascular patients: it lowers their resting heart rate. Increases in endurance training have been shown to reduce the aerobic workload on the heart while participating in average everyday activities. Lowers blood pressure, increases BMR, also increases HDL cholesterol, which is the healthy kind, and it reduces the blood platelet adhesiveness, which is what causes heart attacks in patients like that. So exercise risk: if a cardiovascular disease patient were to participate in vigorous exercise, they are at risk of having a cardiac event, and they should stay below that. But if they were to do that, it's still only an acute increase from what the risk of a regular person doing that is what studies are showing now. There's actually one study that I was reading about where they had over 10,000 patients who have cardiovascular disease, and only 6 of them had an incident when they were getting to the moderate to vigorous exercise level. And they had a physician with them while they did that. So again, exercise benefits far outweigh the risks. So in the bottom corner, I have some light weightlifting suggestions. A lot of it is based off of some stuff that I see in physical therapy, and none of this should go above any of the lower limits set for cardiovascular disease. For an upper body, I got them on a chest press machine for 2 sets of 10 reps, a row machine for 2 sets of 10 reps, light military press, bicep curls, and tricep pull down. For lower body, got a leg press machine for 2 sets of 10 reps, light mini dumbbell squats, step ups and heel raises, as well as hip 4-ways with flexion, abduction, adduction, and extension with TheraBand. And for core, I got bird dogs, anti-rotation bicycle kicks, T-band trunk rotation, and dead bugs. These exercises, again, they wouldn't push anyone too far over, and they should be watched while they are doing that. And what this does is it increases the functional ability for these patients and a better livelihood, as well as reducing the risk of having a cardiac event.